Hello, my name is Gary Artabelli and I'm the Community Pharmacy Matod Program Manager at DASA. My role is to provide education, training and ongoing support, including issue resolution, to all South Australian community pharmacists who provide Matod dosing services. As a Suboxone prescriber, most of your patients will dose at a community pharmacy, so I'd like to share some important tips and information with you today from a pharmacy perspective to help ensure the best outcomes for all of our patients and clients. Firstly, I'd like to talk to you about the importance of communication between prescribers and pharmacists. Pharmacists are often the last step in this process and may at times require real-time support while issues are occurring in their pharmacy. It's important that prescribers are accessible and available to help resolve these issues as they are occurring, as small issues can often escalate in the pharmacy. It is also important that your practice has cover doctors when you're on leave to help make decisions while you are not present. Pharmacists can also help provide important details to you regarding patients' physical and mental health and any changes, as they often see these clients every single day for daily dosing, while you as the prescriber may often only see them once every few months for medical reviews and new prescriptions. Some common issues which pharmacists may contact Suboxone prescribers about for help and resolution include missed doses as per the guidelines, intoxication, challenging behaviours, issues with payment or pharmacy debt, presentation of prescriptions from other prescribers for monitored drugs, either identified via Script Check SA or by presentation of the prescription, decisions on lost, stolen or broken takeaway doses, and most recently, if a client is required to home isolate as a result of COVID, collection by a third party or home delivery will need to be arranged. DASA can provide support in this context. As community pharmacists will have different levels of expertise and Matod practice, there are also some common pharmacist errors and issues which you may encounter. These include pharmacists continuing to provide dosing on an expired prescription, sometimes specific instructions such as scheduled dose reductions may be missed, as well as attendance issues or self-cessation of treatment not being reported to the prescriber. Dosing errors may also occur and will need to be handled accordingly. Specifically, as a non-accredited Matod prescriber, there are certain issues that are commonly reported by pharmacists to DASA and clarification sought. These include not obtaining an S18A authority from the DDU, incomplete Matod prescriptions or prescriptions not valid. It is important that Suboxone prescribers familiarise themselves with the requirements of Matod scripts, including specific information which should be included on all Matod scripts as per the DDU. Prescribing outside of guidelines is common, including high initiation doses, which can be a very high risk, and prescribing unsupervised doses outside of the takeaway framework are also common. In these cases, you can refer to the DDU risk assessment tool. Another issue which is not quite as common but has been seen includes non-accredited prescribers prescribing Subutex and to a lesser extent methadone. So in conclusion, non-accredited Suboxone GPs are an important part of Matod treatment in South Australia. They increase accessibility for clients, especially in areas where there are limited accredited Matod prescribers. Hopefully this information today will help raise awareness of potential issues to consider, and please keep in mind that extensive support is always available from DASA, including DACUS and ADIS. Thank you.